sawa. Check, 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 check. Check, 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 check. So, yeah. Can you, okay. You can speak from here.
Thank you very much for joining us. Good morning. As we wait for the colleagues outside to join us, we are starting in the next 2 minutes. And apologies for the delay. Okay, thank you very much. My name is Diana Geshengo, a campaigns manager at Amnesty International Kenya. I will be your moderator for the first session of this launch. A time every person, every employee looks forward to the time when they will be evaluated for their performance after a set period, expecting a reprimand or a pat in the back. Students, especially, receive report cards every other time, and that's the reason we are here. We believe we are employers, we are parents of this government, and we are here to see how they did in terms of human rights. Before we start, I'd like us to stand and start the session with the national anthem and the East African anthem. Tufanye sote bidii, nasi tujitoe kwa nguvu, nchi yetu ya Kenya tunayoipenda, tuwe tayari kuilinda na tujenge taifa letu heshima, tungane mikono kazini, kila siku tuwe na shukrani. First anthem of the ESC. First stanza. Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike, umoja wetu ni nguzo yetu. Thank you very much. You may take your seats. To start off this launch, I want to invite the chair of the board, Amnesty International Kenya, Awor Ayecho, a leader in this country who every day embodies the readiness of the youth to care, to nurture the Kenyan nation while linking it to the global reality. Karibu sana, Awor. Makofi kidogo. Let's warm our palms.
Thank you so much, Diana. First, I'd like to welcome everybody this rather chilly Tuesday morning. Thank you for coming and gracing this event. So as Diana has rightly put it, it's time for us to see how well our employees have done in the last 10 years. So just a quick introduction of who we are as a movement. So Amnesty International Kenya is part of the global amnesty movement of 17 million supporters committed to protecting and promoting the fundamental freedoms of all persons. So over the last 6 months in Amnesty Kenya, we have listened to communities from 69 wards across some of the poorest counties on what they expect from the candidates and what their human rights manifestos should have in as far as furthering the development agenda within these counties. So we have also supported and continue to support town hall meetings for citizens to dialogue with their incumbent leaders, and also for prospective office and duty bearers. We have established Freedoms Watch 2022 fortnightly, which is a community-based perception surveys that gauge levels of incitement and violence as they relate to the elections. And of course, as you have seen, several debates going on across the country, and Amnesty has been at the center of organizing these meetings. And for those efforts, I would really like to thank the staff who are here today, and of course those who are not present, in ensuring that the voices of the people are heard and their questions are answered. Now, of course, as we get into this session today, we're looking at what it is has been done, good and bad, and what is yet to be done, and what we are expecting from our leadership going forward. So it's about holding the current government responsible and accountable, and ensuring the same for those who are coming in. So on behalf of the board, the staff, and members of Amnesty International Kenya, I welcome partners and members of the press to the publication of the Missed Opportunities, a scorecard on the Jubilee administration. As we shall hear, the scorecard is a comprehensive assessment of the performance of the Jubilee administration over the last decade. A decade is a long time. Plenty could have been done. So we need to see how much of that has been accomplished. It is also a baseline for the next government to raise the standard of human rights realizations for all Kenyans. We are talking both civic, political rights and economic, social, cultural rights. So, as we shall hear, of course there's much that will be discussed going forward. So I encourage you all to read the scorecard, develop your own assessments, and contribute to the national conversation. I welcome you again to this forum, and thank you so much. And I'm giving it back to you, Diana. Thank you.
Thank you very much, Awor, for welcoming us and laying the background of who we are as Amnesty International Kenya, a movement that incorporates everybody, including people from the fourth estate. Those who are not members, please look at our website and become members so that the next time we are scoring the government, we are scoring it together with you. At this point, I'd like to invite Lawrence Mute and Lavenda Namdiero to come and present to us the scorecard. This is like, you know, Professor Magoha, when we are waiting for Mutihani House, this is that moment. So please wait very, very keenly. Let's hope there are a few people who will celebrate and others who will have to bear the burden of failing to honor their responsibility. Lawrence Mute said, I don't give him any title, but I know him as a scholar, a human rights expert and practitioner, formerly a commissioner at the Kenya National Commission on Human Rights, a commissioner at the African Commission on Human and People's Rights. He eats, lives, breathes human rights. Okay, so he's the one who led this particular analysis, and he will work very closely with Lavenda Namdiero, a human rights expert and practitioner, a campaigner who has really excelled, especially at economic and social rights, from housing to health, to issues of dignity, a very, very organized, but she's also passionate about animal rights. So the next time we are scoring broadly other rights, she's also an expert. Karibu, Lawrence.
Thank you very much. Ladies and gentlemen, friends, good morning. I hope you can hear me, right? So, the aim. You're there already, are you? Yes. Ah, excellent. So the aim of my presentation, let's say our presentation this morning, is to introduce the scorecard. So this is a scorecard on the Jubilee administration. This scorecard has been prepared by Amnesty International Kenya with its partners. And I think in terms then of the aims, why prepare a scorecard at this time? As has already been mentioned, it's 10 years since the Jubilee government was elected in 2013. So it's 10 years. The Jubilee government is leaving office this year, or at least, I don't know, it may come back in some other form, but it's leaving office. And so then the question then becomes, how have they done on or in respect of the human rights commitments which they made 10 years ago? So I think from the very beginning, it's important for us to stress that what is being assessed here, the card, is in relation to what, or the commitments which were made by the Jubilee government those many years ago, the extent to which those commitments have been realized. So I think it's important to keep that context in mind, because otherwise you begin wondering, why are we giving them so many reds and so many yellows, as will become apparent as we proceed. So then, in terms of the aim of the initiative, this study, it was to support the advancement of full citizenship rights for all and an accountable state by assessing the human rights performance of the Jubilee government during its time in office. Now, how did we do this? Obviously, we did it. A lot of it entailed, primary but also secondary study, data collection. It's important from the very beginning to acknowledge that although it came quite late in the day, we also actually did get a formal response by government. We did get a formal response by government. And so actually, perhaps I should also say that what then you have this morning is you have a summary of the scorecard. Later, I think Amnesty will be putting up a full report of the scorecard. And as part of that full report, you will be included actually an annex which sets out government responses. How did the scorecard look like? It covered 5 areas. So our scoring covered 5 themes: liberty and security of person, a civic space, the right to the highest attainable standard of health, the right to adequate housing, and the right to food. And then within that, you actually then would also see cross-cutting issues. Discussions around corruption or anti-corruption, discussions around issues such as gender, disability, etc., etc. So, now, in terms of the assessment criteria, the summary matrix uses 4 criteria to rate the extent to which the Jubilee government took measures to ensure the human rights of Kenyans. So we have, I think, color green, which is effective or full implementation. So that would be green, full implementation. So if you get a green card, that's full implementation, effective implementation. Then you have a blue card, substantial implementation, blue. Substantial implementation assumes that yes, indeed, there was some meaningful implementation. So government did undertake some meaningful implementation in respect of the particular human right, which actually did make some difference in the lives of Kenyans, some meaningful difference in the lives of Kenyans. Then you have partial implementation, which is a yellow card. Now, partial implementation, yes, government did take some steps, okay, vis-a-vis the particular right, but unfortunately, that or the steps which the government took did not lead or result in meaningful enjoyment of rights. And finally, you have ineffective implementation, which is a red card. Essentially, really there, no effective actions were taken by government, and therefore, Kenyans did not enjoy the exercise of the particular human right. So then moving forward, what I shall do, again, I recognize, I have limited time, so I may not necessarily go through all of this, but I'll try to explain at the level of each theme and some of the sub-themes, the approach, the conclusions, the findings which we made. So beginning with liberty and security of person. Liberty and security of person. And we were assessing that under a number of themes, extrajudicial killings, enforced disappearance, prevention of torture, deprivation of liberty, protection of women against violence, and a number of others which I shall be explaining. Now, so what was our finding in respect of ending use of excessive force, enforced disappearance, and extrajudicial killings? Now, so actually what we did here is after everything was considered, we issued the government with a red card. So here, in respect of extrajudicial killings, in respect of extrajudicial killings, in respect of enforced disappearances. Now, the government did make pledges to protect Kenyans against these things, against extrajudicial killings, against enforced disappearances. I should point out that where were we getting government commitments? We were getting government commitments from official documents of the government, such as the MTPs. So medium-term plan 2, medium-term plan 3. But actually, when you look at those MTPs, you'll find that the government's pledges on human rights were extremely understated, if at all. So there were hardly specific human rights commitments in the MTP2s, MTP3s, using the human rights framework. They looked for other ways of discussing those sorts of issues. But actually, you, for example, look at government commitments vis-a-vis its engagement at the international level. And we were particularly, the Universal Periodic Review engagements of the government were particularly useful for us in our assessments. And so that's why we are still able to say that even though MTP 2 and 3 may not have been specific, explicit, government still did make commitments. So that's a point I wish to put out there from the very beginning when I speak about commitments. So what then happened in this respect, in respect of extrajudicial killings, enforced disappearances? Enforced disappearance and extrajudicial killings remained, we use the word common, I'm sure a government might contest that, a common practice under the Jubilee government. Now, so you ask us for manifestations. The sorts of manifestations we'll be speaking about would be the enforced disappearance of persons who were taken into custody by security forces, for example, during counter-terrorism operations against the Al-Shabaab. I'm sure many of you, gentlemen and ladies of the media, would have reported, again, instances, for example, where a person goes through a court process, they are released from the judicial proceeding, and more or less almost immediately they are disappeared by the state. Sometimes now to come back, sometimes to come back a couple of weeks later, and then at that point they may not necessarily tell you what happened, okay? Now, or the dumping of bodies of disappeared persons into rivers. I think that is something which quite recently has become clear that it is happening in this country. If you look at the work of Amnesty, if you look at the work of Haki Africa, where they have found bodies dumped into rivers like River Yala. Now, the government's record of investigating the killing or disappearance of Kenyans in the past decade was not good. And even where investigation and prosecution of killings took place, the process was slow, it was tedious, it was painful for victims who are seeking justice, for the killing of their kin. I think all of you will recall the 2016 killing of Willie Kimani, of Josephat Mwenda, and also of Joseph Mwiruri. And, that prosecution, that case went on and on and on. And possibly, we are seeing the end of that perhaps this year, we're not sure. Now, one of the concerns which this study has raised is that Kenya has not specifically legislated against enforced disappearance. Kenya has not become party to the International Convention for the Protection of All Persons from Enforced Disappearance, which we think is important international instrument, again, which would support the legislative framework for protecting Kenyans against enforced disappearance. Now, prevention of torture Here, we give the government a yellow card. Why? Because we actually do acknowledge that there was some movement. So there was movement. There was enactment of the Prevention of Torture Act. Many years ago, when I was a member of the Kenya National Commission on Human Rights, we worked extremely hard with civil society and others, and there was a draft bill, I think as long ago as 2010, 2011. But it wasn't until much later, within the Jubilee administration period, that then this eventually did become law. Of course, it was pushed into law by private members. I think one needs to acknowledge that. But still, it did become law. But it's not good enough just to enact law. The government did not institutionalize the act, including by providing the Kenya National Commission on Human Rights with the necessary support for undertaking its mandates of investigating and monitoring torture, which was a specific requirement under the act. And also we cite other things that the government did not operationalize, has not operationalized the National Coroner Service Act by establishing the National Coroner Service, which again would harness forensic medicine to handle investigations on deceased bodies. And again, we can cite other things. I mean, think about the Victim Protection Trust Fund, which again was anticipated, but which has never been operationalized. We also note that the government has only become part of the optional protocol to the Convention Against Torture, which again would facilitate the process of preventing torture in the country. Now, then we look at ending deprivation of liberty. Ending deprivation of liberty, still under the first heading. So ending deprivation of liberty. And in this particular instance, because remember, Amnesty and the partners could have chosen to discuss so many things. So you actually had to be smart in terms of what you discussed, what you focused on. So on this particular one, the study's focus was quite particular in respect of persons with disabilities, specifically persons with psychosocial disabilities and persons with intellectual disabilities. And so the finding here is that despite clear directions from the courts, where the courts were telling government, look, your current legislative framework, criminal legislative framework for addressing or dealing with accused persons who either have intellectual disabilities or who have psychosocial disabilities is wrong. It is unconstitutional. So that message has been sent to government multiple times by the courts, loud and clear. Government has done nothing. So we issue a red card in that regard. Now, ending violence against women. Here we have issued, the study issues a yellow card. The government was ineffective in its use of laws. So first and foremost, yes, of course, you have to acknowledge good. A law such as the Protection Against Domestic Violence Act, the fact that actually it was enacted and that it is supposed to address sexual and gender-based violence. But then it's not just about putting law in place, it's actually about supporting, it's about resourcing the law. And what we are saying is that the government did not provide victims of violence with adequate medical services, and the sorts of things that concern victims of violence would be things like counseling, adequate safe shelters, and gender violence recovery centers, things like those, which were not put in place in adequate numbers. Again, of course, also the question of training of investigators, of prosecutors, and people like those. We also, you'll see in the study itself, we also make findings in respect, for example, of the FGM situation, female genital mutilation, where despite, again, having a law in place, huge difficulties remain. We also make a finding in respect of sexual minorities, where we issue a red card. And what we are saying here is that actually, if you look at the situation of LGBT persons, there's lots of violence which continues to happen. There's lots of discrimination which continues to happen. The attempt by the sector to have Section 162, I think, and Section 163 repealed, failed in the High Court. So again, on that basis, we issue a red card in that regard. Actually, on the positive, so I spoke about LGBT. Consciously, I didn't say I. So these intersex persons. Because on the contrary, a quite rare occasion, we issue a blue card in respect of intersex persons. So this means, in our view, that some meaningful implementation did actually take place in respect of intersex persons. So saying government began to implement recommendations of the task force on policy, legal, institutional, and administrative reforms regarding intersex persons in Kenya, which was established by the Attorney General, I believe, in 2017. That task force concluded, among others, that laws, admin actions, institutional arrangements within the health, education, employment, civil registration, etc. sectors actually were problematic. They were fashioned along a binary concept of male and female, and that this actually needed to change. And why do we say that there was positive change which actually did make a difference? The fact, for example, that in the 2019 national census, you actually had questions specifically focusing on intersex persons. The fact that, I'm sure I can say this, the fact that I believe now at the Kenya National Commission on Human Rights, you actually have a commissioner who is an intersex person declared as such, publicly. So that's a good thing, that's positive. Now, then we go to theme 2. Theme 2 was on civic space. Civic space. And here, speaking of a number of issues, first, speaking about freedom of expression online and offline. So freedom of expression, and perhaps you'll be surprised here that we actually issue a red card. Remember what I said at the beginning. It's not about whether you can express yourself online today. I think it's important to stress that. It's about what commitments did the government make? To what extent has the government implemented the commitments it made? So to what extent, therefore, are Kenyans enjoying the particular right relative to the commitments which the government made? So I think it's important to keep that in mind as we have this discussion. So here we are saying, yes, indeed, government did make commitments. If you look at the ICT policy, the government did make commitments, for example, to promote the use of social media. But then what did the government proceed to do? The government proceeded to use laws such as the Computer Misuse and the Cyber Crimes Act to arrest, to harass, to prosecute activists for raising governance concerns on social media. And I think it should be apparent, I hope we do recall all those instances, where bloggers have been arrested, where social media activists have been arrested, prosecuted, allegedly for publishing false information, when actually our sense is that a lot of the time, that actually is a ruse, to stop people from speaking about difficult issues. And actually the courts agree with us. The courts agree with our finding. Because what the courts have done in the past 5, 6, 7 years is that quite often the courts have declared as unconstitutional many of the government's actions involving the prosecution of media practitioners and human rights defenders using social media. So if you look, for example, at the Kenya Information and Communications Act, which criminalizes offensive false communication, declared unconstitutional, that discussion again and around criminal defamation. So there's lots of examples there. I think Section 194 of the Penal Code, which criminalizes defamation, again, declared unconstitutional. So we have many examples. Now moving on, media freedom. So please distinguish. Earlier we were speaking about freedom of expression. Here we're speaking about media freedom specifically. Here we issue a yellow card. Now, the government passed, this is quite positive. The government passed the Media Council Act. The government also created the Media Council of Kenya, or rather, under that law, therefore, then the Media Council of Kenya was created. And then you also have the Media Complaints Commission. So this definitely was positive. Now, speaking about ranking, you have the World Press Freedom Index. And in the last couple of years, Kenya has been, the Kenya ranking has been relatively low. Now you'll tell me that actually this year, the most current ranking, the Kenya World Press Freedom Index ranking has gone a little high. Now the context, of course, is that we need to keep in mind that yes, it's about a rank. It's about going up, but actually it's about the global picture. It's quite possible that as a country you go up in your ranking because some other countries went down, not because in overall terms you actually improved. So that's the context within which then we are having this discussion here. And what we are saying is that freedom of press in Kenya declined, and actually in fact we were quoting the Media Council of Kenya, because of threats and intimidation from politicians and their supporters, the harassment of journalists or destruction or confiscation of the equipment by law agencies. And then again, journalists continue to face both legal and physical threats, and including death. I think some of you may recall the John Kitui situation, a couple of years ago, where. Now, courts tended, unfortunately on this particular one, the courts tended to issue excessive and unjustifiable defamation awards to litigants. So we actually, and the study recalls a 2021 judgment against a local newspaper, which are awarded to plaintiffs, I think it was something like 22 million shillings damages. Now that's excessive by any standard. Now, then we move to data protection, where we issue a yellow card. So for data protection, we issue a yellow card. Now, government enacted, on a positive, the Data Protection Act. And also government established the office of the data commissioner, and that position now is filled. So I think that's positive. Now, in the meantime, to data protection for Kenyans in the last few years. And what do you see? You see the government launching the issuance of Huduma number without conducting a data protection impact assessment. You see public release of names and identification numbers of people who allegedly failed to file their taxes. I think that was Kenya Revenue Authority, a government agency, okay? Or you see the registration of Kenyans to political parties without their knowledge or consent. So you see all these are contexts within which then Kenyans have to worry, about their data and about the extent to which data is protected, despite the fact that now we do have a framework, despite the fact that now we do have a data commissioner. Now, moving on, freedom of association, where we issue a yellow card. Now, there were multiple pledges, again, which were made in this regard. For example, in the UPR 2015, Universal Periodic Review Engagement with Government of Kenya and the UN. Now, I think many of you around or in this room will be from NGOs, non-governmental organizations. You do know that for many a year, we've had, or you've had your Public Benefits Organizations Act, which has never been gazetted. Its commencement date has not been gazetted. Government has made multiple pledges in this regard. This has never happened. Now, in recent years, because I think it's not just about pointing the negatives, I think the study acknowledges, when you look at it, the study acknowledges that the NGO Bureau board has been more amenable to engaging with civil society. But actually, when you look at things in overall terms, you also do recall many instances where the NGO Coordination Board has undermined the right of Kenyans to freedom of association by seeking to deregister or declining to register NGOs. And we can cite examples. Kenya Human Rights Commission a couple of years ago, where they were taken to court, where the attempt was to deregister them because of some apparent, I don't know, misdemeanor or felony, I'm not sure. The Muslims for Human Rights, also Haki Africa. Now, I think I'll move on because I know that time is limited. We also make findings in respect of freedom of assembly. You can look at those. We also, so in respect of freedom of assembly, we actually issue a red card. Remember, the context for freedom of assembly was Kenyans meeting to discuss issues of relevance, to raise concerns about corruption. So actually this freedom of assembly, but also even the next slide on freedom of association, Kenyans raising concerns around corruption, or even in 2017, around the management of the elections, if you recall. Obviously more recently around COVID. We've had all these situations where Kenyans have been in contexts where they would wish to meet, where they wish to associate, and under the guise of preventing COVID, then Kenyans are stopped from meeting violently. So I think that's a context within which those couple of slides should be understood. So I want to move to the third theme, the right to the highest attainable standard of health, the right to the highest attainable standard of health, something which we have not mentioned this morning as we've been speaking, but which I'm sure is obvious, should be obvious to all of you, is of course that this discussion is anchored on the Constitution. So we need to keep that in mind, that this discussion is anchored on the Constitution. And so obviously in this regard, we are speaking about Article 43 of the Constitution, which guarantees every Kenyan the right to the highest standard of health. And here, our assessments were in respect of quite a number of things. I will not mention all of them, but I'll highlight some significant ones. Now, issue number one, universal health coverage. Now, this has been a big one. So you'll ask, so why do you give it a red? Universal health coverage. I think the context for universal health coverage needs to be understood. So remember, step back, we're not speaking about, we're not speaking about health generally. We're speaking about the specific universal health coverage program as proposed and implemented or attempted to be implemented by government, okay? Now, what actually the government did was at first it began with a pilot program around 2018. So you had this pilot program which covered a number of counties, I think Nyeri, Kisumu, Machakos, and Isiolo. And this was supposed to be the precursor to the universal health coverage program, the full-blown one. In reality, actually, although in our assessment, we did not think that there's been enough documentation which has been put out there assessing the results of the pilot study. But yet, it is quite clear that actually the pilot study was not successful. And there are lots of constraints, whether it's in respect of staffing, so workforce performance, whether it was in respect of the impression that actually patients would not pay out of pocket, but actually in reality they did have to pay, whether it was in respect of there not being strategic direction on implementation of the universal health coverage program. Actually, earlier this year, if you notice, the government then launched the National Universal Health Coverage Program, I think on the 7th of February. But again, it's not quite clear what then it actually entails when you look at the paperwork. There's not been adequate communication in that regard. Now, I want to speak about, so we also make findings around health insurance, where we give the government a yellow card. Clearly, there's lots of work which was done in this regard. For example, we cite that there was a huge increase in the number of people who are registered under the NHIF over that period. So there was a lot, there was a big increase. I think the membership of the NHIF increased by 71% from 4.5 million members in 2013 to 8.5 million members in 2018-2019. I think the challenge is it's one thing to have many members. It's quite another thing whether those members are actually enjoying benefits, the benefits which are touted that they will actually be provided. And part of the concern is that many indigent Kenyans will not be able to keep up with the payments. So at some point they drop off. And that actually is the experience we found in relation to this. That was the experience which we found in relation to this. That at some point, Kenyans were no longer able, poorer Kenyans were no longer able to pay the premium. Now, also, that hydra of corruption then also plagued the whole NHIF cover process, which again we detail in this report. Now, let me talk about primary health care. Actually, before I speak about primary health care, I think it's fundamental that I raise a particular point under the NHIF discussion. And it's this one. And I don't know the extent to which even the current party manifestos address this, because really, as Amnesty and the partners here, there has been this discussion and this concern. If you look at the approach, the insurance approach of the government, it has been using, or the government uses, what you could call the contributory insurance or contributory insurance. So essentially, for financing health. So, you're telling Kenyans contribute, and that way we finance your insurance, you finance your health. So that's classic World Bank. I think the concern is that the subscription model imposes a financial burden, as I have explained, on the poor. And the net effect of that is that you enhance profits for private sector, hospitals, etc., while actually not providing services to the poorest. And that's why there needs to be a discussion, possibly, about moving away from that subscription model. And I have a strong feeling that one of the panelists might take up that particular discussion because it's something which we discuss in the report, and I think it's relevant for us moving forward in the country in regard to access to health. Now, primary health care, I think, without reading all these bullets, for me, and I think for the study, the bottom line is this one, that we seem, and the government, the Jubilee government, has seemed to be fixated on big projects. So these will not be projects in level 1 hospitals, level 2 hospitals, level 3 hospitals. There will be big projects with big capital outlays over the past 10 years. That's why you have things like MES. That's an acronym. That's why you have initiatives which are instituted, and you're not quite clear how they benefit the ordinary mwananchi, and that really is something which we need to think about moving forwards, particularly for then any government which comes into office moving forwards. Now, I hope as I've been speaking, you've been also looking at those bullets there. Now, access to safe abortion, let me focus on this specifically. Here, we gave the government a red card. Why? Now, we know what our constitution says. We know that there are certain circumstances under which abortion is allowable. Now, for this to happen effectively, government needed to put in place certain regulations, certain standards, certain regulations. So standards and guidelines for healthcare providers on how and when to provide safe abortion care. But what did the government do? You had these standards which were published early on, and then you had those standards which were withdrawn. There was an intense court process which took place. Government was ordered to reinstate those guidelines. Government has never done that. That cannot be a good thing. Okay, devolution of health. We must admit devolution of health indeed did happen in this country, but clearly it did happen with lots of problems. So there you have a yellow card. So yes, indeed, health functions were transferred from the national to the county levels. But they were transferred quite often without the necessary structures and institutions being put in place, being established, without counties having capacity to undertake devolved tasks. And so then this contention between national government and county governments in terms then of who is supposed to do what. And again, the whole big question of corruption again reared its head. Okay, this theme did have quite a number of other sub-themes which I have skipped and which I trust you'll be able to look at in the paperwork which we have provided. So let me then focus on the last two themes. First, beginning with the right to adequate housing. The right to adequate housing. Now, here we speak about access to affordable housing. Access to affordable housing. And in respect of access to affordable housing, we give the government a yellow card. Now, the government definitely did take some policy, some programmatic, some fiscal measures to support affordable housing initiatives. Now, what I wish to say here is that when we are speaking about affordable housing, necessarily the programs then which were being put in place were targeting the formal income earner rather than the informal income earner. So you will see, when you look at the annex of the government response, that indeed the government correctly points out that also they did undertake social housing. So social housing program, which then would be intended perhaps for the informal sector. Our concern as a study is that actually far more energy was put into this affordable housing program, basically entailing this small cadre of people who earn formal, people who are in informal employment, as opposed to those who are in the informal sector. So, but when you look at the formal sector, when you look at the affordable housing program, indeed the government did certain things. It established things like the Bomayangu online platform, things like creating the Kenya Mortgage Refinance Corporation, okay, which provides, you call them loans at, hopefully, lower interest rate. Initiating affordable housing projects in quite a number of places. I think you look at places like Pangani, Ngara, Mavoko. So there are those things which have been done. As I have said, the affordable housing program has really not realized the intended aim of providing Kenyans with adequate housing, because this program targets formal income earners. It is not configured to support households within the informal economy. And that's a big problem. In fact, actually, if you think about formal income earners, and if you think about many of them earning somewhere between 50,000 and 100,000 shillings, what you'll actually find is that the affordable housing program would still be out of reach for many Kenyans who actually indeed have formal employment. So that becomes a big problem. Now, then we speak about evictions, where we give the government forced evictions. So you give the government a red card, forced evictions. Now, forced evictions of thousands of Kenyans happened in the past decade. And this forced eviction happened to make way for infrastructure development projects or private development projects. And you can cite many examples. I think nearly 10 years ago now, the Sengwer community, who are living, I think, in Embobut forest in Cherangani, they are being burnt out of their houses. Or the demolition of homes of people living in places like Jomvu. Now, this was an informal settlement in Mombasa, and you're demolishing those homes. I think it was the Kenya National Highways Authority doing that, as part of preparations for a highway expansion project. Financed by who? Financed by people like the African Development Bank, the German Development Bank, and the European Investment Bank. So you see, it's projects. So projects are pushing out people. Projects pushing out people. That cannot be a good thing, particularly if we are doing it in a human rights and compliant way. And we cite many other examples. The eviction of hundreds of residents of Deep Sea and residents of Mukuru, Kwanjenga, also in Kibos, in Kisumu. Now, so I think we should note, and we do note in the report, that there were some important legal changes which happened, for example, in the Supreme Court, where you had a Me Too Bail decision, whose really effect was to say that landless occupiers of public land who establish homes there acquire a protectable right to housing. So that was important. And then in 2016, you had an amendment to the Land Act to prohibit unlawful occupation of private land. But I think also there's been a bill, which has been prepared again on these issues, but which has never been enacted into law. So again, that's a concern which this study has. So finally, let me speak about food. So the right to food, the right to food. And first issue, where we issue a yellow card, I believe, first issue, relates to policy and programmatic reforms in agriculture. Policy and programmatic reforms in agriculture. Now, I think what we note is that the government's programs focused on supporting the growth of large-scale food production, whereas the majority of farmers in this country are actually small-scale farmers. Now, my so far excellent equipment is failing me. One moment. So yes, on one hand, you have all these aims, because actually when you look at the documentation, when you look at the relevant programmatic papers, they are fairly good. But now the challenge of implementation. You look at the extent to which the agriculture and food sector was given resources. It actually received lower budgetary allocations. And to give you an example, in the 2019-2020 national budget, which was 2.9%, and this was down from 3.5% in the 2016-2017 budget. So then when you speak about things like provision of fertilizers, to farmers, and whether or the extent to which that has been happening, you can then see the context. That actually perhaps as government, they were not too interested in support, or rather, they figured there were better priorities than agriculture in that regard. The government did not, again, undertake effective interventions to ensure sustainable agriculture by addressing physical and economic access, as well as unequal and inefficient food distribution. So, you had losses you had wastage of as much as 40% of food, grown in Kenya, which was occasioned by things like poor storage, poor infrastructure for accessing markets. Finally, in this presentation, I want to address the question of food insecurity. The question of food insecurity. And it's not a surprise, really, that when Kenyans are dying of hunger, when Kenyans perhaps do not have a meal on a regular basis, that then we would have issued a red card in this regard. Now, in 2017, the government adopted the National Food Security Policy Implementation Framework, whose goal is to ensure that all Kenyans enjoy at all times safe food in sufficient quantities and quality to satisfy their nutritional needs for optimal health. So that was a 2017 aim. What is happening in Kenya today? Millions of Kenyans remain highly food insecure due to things like failed rains. Of course, government might say, wait a minute, it's not us who cause rains to fail. But then you anticipate that rains will fail. So what programs have you put in place to anticipate that and to address that? Low agricultural production and high food prices, okay? And high food prices. And we have figures there. For example, I think in 2021, in November 2021, where you had 7.9 million Kenyans lacking sufficient food for consumption, which corresponds to 15% of Kenya's population. I think particular concerns have to be raised in respect to the ASAL areas, where you have many, many, many counties in this country where they do not have food because of the factors that we have highlighted. And also, we highlight food security in informal settlements, which again is quite tenuous. So you have many households who cannot afford to buy food in adequate quantities and quality. And this results in high prevalence of hunger and malnutrition. And remember, actually, this study was done before the most recent price hike. So you can imagine then that this situation has become even worse. So my final word, and therefore the final word of the study, is that, yes, indeed, government came into power, government made human rights commitments. I explained the context within those commitments were made. Remember also, government was implementing the Bill of Rights, which is part of our constitution. Government stated that, pledged that it would uphold the constitution. So even at that level alone, you then would have expected it to put in place, to fund, to resource measures to ensure Kenyans effective exercise of human rights. But really, our overall finding is that, yes, certain things were done, but in overall terms, the Jubilee government did not do well in respect of ensuring that Kenyans could enjoy and could exercise their human rights in these various areas which we have listed. And that the government also did not use a human rights-based approach under which human rights norms and principles guide relationships between Kenyans as rights holders and the Jubilee government as the agent of Kenyans, as the duty bearers. I think I'll stop there. Thank you very much for listening to me. Thank you.
Thank you very much, Mute. Does that feel like the Kenya we were in? Does that score represent the Kenya we live in? By and large. Members of the fourth estate, should we change your score? Okay. Now Lavender will present on the asks and recommendation of whichever government becomes the incoming government. And I want to note that we invited all aspiring governments to be here. They're not here, so I'm not sure whether human rights is an agenda to agenda for the next government.
Thank you, and thank you, Lawrence, for that really detailed presentation. So these following recommendations are proposals for the next government, as Diana has said, both national and county government, if they wish to improve the track record that has been left by the Jubilee administration. So I'll begin by the Liberty. Across the country, and fast-track anti-sexual and gender-based crime strategies for the police service, the Director of Public Prosecution, and the judiciary. Within 365 days, we'll expect them to have introduced legislation to abolish the death penalty, to audit and reform the criminal justice system in order to ensure that there's equal access, decriminalization, and just treatment of persons with psychological and intellectual disability by amending the Criminal Procedure Code, the Penal Code, and the Evidence Act and other relevant laws. With regard to civic space and freedoms, within 100 days, we propose that the ministry in charge of Interior and ICT publicly reaffirm the right of all Kenyans to express themselves freely, associate and assemble, and the safety of journalists and the media when they're conducting their work. In 180 days, the ministry in charge of legal affairs must review all laws restricting civic space, including the Computer Misuse and Cybercrimes Act. The ministry in charge of ICT needs to increase funding to ensure full implementation of the Data Protection Act and review all government programs operating within the risk of large data breaches. And lastly, the ministry in charge of the National Treasury must increase resources to the independent offices, such as the Kenya National Commission on Human Rights, Director of Public Prosecutions, and the Judiciary, all of which monitor civic freedoms and promote citizens' rights. Let's move to the right to health. Within 180 days, the ministry in charge of health, the incoming national and county administrations must participatory public review and launch a more comprehensive universal health coverage program involving all health stakeholders. It needs to ring-fence the NHIF for public facilities only and increase funding for public facilities as well. It needs to invest adequately in health workers and health infrastructure. Lastly, it must finalize and disseminate safe abortion guidelines and standards, publish standards and guidelines for reducing morbidity and mortality from unsafe abortions in Kenya, and the national training curriculum for the management of unintended, risky, and unplanned pregnancies. Within 65 days, we expect the same ministries to substitute the subscription-based health financing model with a tax-supported model of health financing to ensure access by the poorest and most vulnerable populations. It needs to expand and improve public health facilities and infrastructure, increase healthcare workforce, and improve working conditions. Lastly, it needs to ensure that there is one doctor and one community health worker for 1,000 Kenyans and 50 households, respectively, and prioritize primary health promotion and disease prevention. With regards to the right to adequate housing, within 180 days, we ask that the ministry in charge of housing and development to audit, resettle, and compensate all victims of state-enforced evictions across the country. We ask them to declare a moratorium on all evictions until the enactment of proper safeguards against forced evictions. We demand that they prohibit forced evictions and ensure that all development projects are human rights-based compliant. Lastly, we ask them to ensure that all persons, including vulnerable people, such as children, women, and persons living with disabilities, and people living in informal settlements, have access to essential services such as safe water and good sanitation facilities. Lastly, within 365 days, we demand that they ensure that all persons living in informal settlements or on land without title deeds get to have security of tenure or are resettled on land that has security of tenure. With the right to adequate food, within 180 days, the ministries in charge of food security need to audit current food security policies and accelerate climate-smart and small-scale agricultural investments. Secondly, it needs to audit and announce inefficient food distribution systems, food wastage, limited storage facilities, and poor infrastructure for accessing markets. We also came up with other actions that we think would be required to entrench fundamental freedoms and human rights. Within 180 days, we ask that the ministry in charge of National Treasury and the Council of Governors to announce and implement a renewed approach to public participation and accountability in transparent allocation and protection of public budgets. Also to implement anti-fraud measures recommended by the Office of the Auditor General and the Ethics and Anti-Corruption Commission. In addition to that, we ask them to commit to auditing and reducing the wage bill and benchmarking allowances to state officers. Lastly, and ask for the Council of Governors and the Senate. The Council of Governors and the Senate need to compel the National Treasury to prioritize regular disbursements to county governments. Thank you very much.
Thank you very much, Lavender, and thank you very much, Lawrence Mute. I'll now ask 3 people to come and help give us what stands out from the scorecard, whether this is Kenya. As we set them up, prepare your questions. Irongo Houghton will take it after me, and we'll open the floor for questions on the scorecard, and thereafter, we have one parent on human rights, the Kenya National Commission on Human Rights. We'll hand over this to them, and that session will be run by Irongo. Okay, I'm told they'll come one by one. For those who did not get the score, just look at how I am dressed. It is largely red and yellow. Okay? Red, yellow. Red, ineffective implementation. Yellow, partial. Blue, substantial. And green, which did not exist in this particular scorecard, is full or effective implementation. To start us off, I'll invite Ravi Ram. Ravi Ram works with the People's Health Movement, is a health activist, a health researcher, and one who believes in social inclusion and various aspects of socioeconomic rights. Ravi, tell us, what did you take away as the biggest missed opportunity, and what is your message for the next government?
All right, thank you very much. A big thanks to all at Amnesty Kenya for having put in the time and effort to examine the government's performance, and to Professor Mute, who's really given a lot of real thought leadership in analyzing a range of sectors and coming up with some scores. I'll focus on just a few elements within the health scorecard, and I'll pick on COVID-19 because it's very current and it shows how the government is adapting to an emergency and how it's responding to in service of citizens or not. Then the universal health coverage, part of the Big Four agenda, and finally looking at this issue of cartels and corruption in the health sector. Number one, with COVID-19, we did hear the right messages initially from the government, but then the real action was to send out the police and to round up people who were not wearing masks, to round up people who were out after a curfew, to round up people who were crossing county boundaries. That top-down, force-based approach generated distrust. And it built on the existing distrust in the health sector because we know that proceeded to that. Professor's already talked about the mess, the managed equipment scandal. Even before that, we had the Kenyatta National Hospital and the attempt to set up a public-private partnership, and I'll come back to that. People look at the health sector and see that there's money, and the government is only interested in the financial aspect of health. So what happened? We were lucky here, not just in Kenya, but across Africa, where globally, we have not suffered the way the rest of the world has. There clearly has been some tragedies, and we've seen it in the health workers also. But in terms of the real effect of COVID, it has widened the divide between the government and the citizens. And that is not what was intended. Finally, I think the legacy for COVID is that there are doubts among the population as to whether COVID is really there, because they're not feeling it directly, and yet the government is sending out force to control their lives. While the media reports, thanks to the media reports on the COVID millionaires. And is that what the government's legacy wants to be? I would hope not. Secondly, turning to the Big Four agenda and health. The government brought us universal health coverage. And as many of you may know, that's part of the UN Sustainable Development Goals. It's goal number 3, right to health for everybody. Unfortunately here, the plan for universal health coverage is not actually for Kenya. It's a near copy-paste of another donor-driven document. We can look to the World Bank for our guidance and not our own Ministry of Health. And more specifically, it is not human rights based. It's not just that we went in there with a plan to say, let's have a subscription model. And Lawrence Mute has talked quite a bit about where the subscription model has failed. But it's actually focused on money. And again, that is a theme that we're seeing throughout in the government's performance, that as much as it may say one thing, it does another. So we have the right words in the preamble to documents about everybody has a right to health, and the Constitution has Article 43. But in reality, if we go beyond the design, if we look at the financing, if we look at the actual implementation, it's really about how are we going to marshal more funds out of the population and move them away from oversight, because we don't have accountability mechanisms. We don't know where that money is going, except that, as professors talked about, we are allowed to spend that money in private health facilities. So universal health coverage has become another way of taking money from the citizens and moving it to the private health. We'll come back to that. On top of it then, what would an adequate, or what would a human rights-based approach to universal health coverage look like? I would say if we really want to talk about in politics, what would it look like? Let's take examples from South Africa or from Ghana, where people are actually engaged in debating with their policymakers about what kind of health system do they want. They haven't settled the debate, so it's ongoing, but we have not even started that here. And that's a gap that we have. I think it's very strong on Amnesty's side that they've put forward a recommendation that within the first 100 to 180 days, that debate will take place here in Kenya. We can also look to Thailand, which has ignored the donor-driven methods and put in place a publicly funded and publicly supported health system. And as a result, they're doing even better economically because they're not losing money in fixing people whose health problems have gone on too long. So specifically here in Kenya, we need to see much more investment in people. Our people, starting with primary health care. Let's make sure that we're not just treating them when they're sick, we're preventing them from getting sick. We're giving them the right kind of care so that they can stay healthy, they can stay productive, and they can look after their children and not be wondering, how am I going to get bus fare to get to the clinic, and then see if they want to charge me for services or drugs. Next, we need to really talk about our health workers, because what we're finding over here, Lawrence put it very well in the housing sector. We're seeing that projects push out people. In the government health sector, we're seeing that procurements push out people, because anything that we do in the health sector from the government side is about infrastructure or commodity procurements. It's about moving money. It's not about putting in place the right kind of people, the numbers and the skills, so that we have a health workforce, nurses, clinical officers, doctors, who can actually address people's needs. And it's because when you invest in people, you have a long-term commitment. When you invest in drugs, you have a short-term contract, and some of it can go in your pocket. So we've got that. Finally, I know we're running out of time. We cannot look to social health insurance as a substitute for a real health system. It's just another way of extracting money out of people's pockets. And as Lawrence said, let's say my name here is Wanjiku Kamau. And I run a kiosk, and every now and then, maybe every 3 months, I go to Busia and I pick up clothes from Uganda so I can sell them back over here. I make money when I can. And when I can't, I live off my farm. Now, when I can't, that means I can't pay my 500 bob subscription fee. I am out of the system, and I may not even know it. And then if my daughter gets sick, and I take her to the facility, and I find out that I'm no longer eligible, do I trust the system anymore? Because the system is not made for people. And that's just the example there. I think last point I'll say is that we've got too much of the nexus between the cartels in the government and the private sector. We have to draw a strict boundary, because as much as we look to the private sector and we say, wow, look how good the quality is, what we're really seeing is what Kenya can do when Kenya has resources. And if we continue to under-resource our public health system, then we'll continue to see poor quality. And that is not the answer going forward. So let's make sure that we don't have procurements pushing out people or profits pushing out people. Let's have a people-based health system. So thanks once again. Very much looking forward to these recommendations coming out in the media. So all of the cameras, all the journalists here, make sure that you're really pushing this forward. Let's have we have less than a month to the election. Let's have some debate on human rights, health, and the other social sectors that have come forward. Thanks so much.
Thank you very much, Ravi. And thank you very much for the challenge to all of us and giving us even where to look for inspiration that health can work for the people. We do not have to do the cartels. And I think one thing that maybe was not emphasized was the ARV issue, okay? And after making progress, projects, profits, the failure to have a people-centered, human rights-centered health system has costed us so much in the progress that we had made on that front. And I'm sure there are very many people waiting to react on this, including the KMPDU. I'll now invite a comrade and a sister to tell us about security of the person, freedom from torture, civic space. Her name is Wanjira. We call her Wanjira Mzalendo. She has another name, but she has preferred to be called Wanjira Mzalendo, and we enjoy that. Members of the media, you will remember a protest where a young activist was cornered by the police, and your cameras were right there. And what did she say? When we lose they lose their power, okay? That is what we need to move to the next government. So you cannot be seen, oh, what do we do? These cameras must also lose their, you have lost your height fear, so they will lose their power not to cover you. They must cover you even with your height. Karibu sana, Wanjira.
Am I audible? Yes, awesome. I would like to begin by asking all of us to rise on our feet and give a moment of silence to all the people we have lost during the Jubilee administration to police excesses and extrajudicial killings. Kindly. Thank you. May we have our seats. The Human Rights Jubilee Scorecard at a glance. The report by Lawrence was spectacular, very, very articulate, but I'd like to give it a red card in matters the security of the person, extrajudicial killings, and enforced disappearance. Because based on my experiences, the Jubilee government has been a government of Madharau for our Kenya, for our rights, and for social justice. We have seen a shrinking civic space since the Jubilee administration. We have seen activists wakiendewa kwa manyumba yao. We remember Mutemi Wakiama with the corruption thing. We remember Sabasaba March for Our Lives. We remember protesters who were demonstrating against COVID-19 billionaires arrested for saying, stop stealing our money. So the Jubilee administration has betrayed Kenyans because we expected so much. I remember there was a lot of euphoria when people were voting for our people. Like the way there's a lot of euphoria now around Sakadra. leadership. So the government is die, and the media was gagged. There was no reporting about this issue. There was no reporting about this issue. It was under wraps. Do not msichomee gava. So we need to see the next government giving proper media freedoms. In terms of our data protection, it has been really, really crazy. Huduma number, being forced to register our lines again. And in terms of femicide, the issue of femicide is not a women's issue. And the more we continue seeing femicide as issue of women, the more we will continue burying our women and shouting about elusive justice. The issue of femicide must be seen as a societal issue. I mean, we are losing our women. Early this year, we demonstrated largely against the killing of Elizabeth, and I'm glad that the woman rep came to demonstrate with us. So we were given some kind of protection by the police. But I'd like to challenge us all in this room to actually take to heart the issue of femicide and gender-based violence. And I think this is largely because of issue of women leadership has been more of tokenism approach, because if we had really, really strong, resilient women leaders, this issue would be given the special attention it deserves. I would like to see an end to extrajudicial killings, really from the bottom of my heart. I would like to see a government that respects the right to life, the right to life. We already are living in deplorable living conditions in our communities. I speak for people living in informal settlements. We already are fighting to afford basic commodities. So when your government has no respect for your right to life, what kind of government is that? When people wake up to go and vote early in the morning, they are voting for better material conditions to lead better lives. So when your government turns the gun on you, your government betrays you. Your government is not for you. Your government does not care about you. And that is not the kind of government, as Kenyans, we want about 60 years after independence, because this is now, we're not talking about colonialism, we're not talking about white dominance. We're talking about our own brothers and sisters who have come to us as Kenyans to say, can I lead you? Can you give me a chance to be your leader? Can you give me a chance to take you to the next level as a country? But what we have seen the Jubilee government do is actually take us back. A lot of the rights and freedoms that were fought by the second and third generation have literally been clamped back. Thank you. Protest. I have addressed the issue of protest. When Kianjokoma brothers happened, the people of Embu rose up. There were massive protests. But do you know somebody else died in that protest of Kianjokoma? So we are not even safe when we come out to protest. A lot of people were worried for me when they saw me in that confrontational video with the police. Like, Wandera, are you safe? How's your safety? We are not supposed to be worried. This is our government. The social contract theory says that the government is not separate from the people. It's not them and us. For example, in this room, we would say we want to form a government. You would come and sell us your manifesto and say, you know, we would vote for it. We're supposed to be friends, but our government has been our enemy. It has been a government of the enemy of the people. I'm using these very strong terms because this has been my experience and the experience of many people in regards to Jubilee government, the thousands of people who have been evicted, not just in Mukuru, Kariobangi, also in Mwea, in Embu. It has been a hellish experience. really, in terms of even food insecurity. Right now, unga is at 200 and something. How many people are able to afford that? In my community, I know people are sleeping hungry without a shadow of doubt. And yet, our leader will come and tell us 2 billion shillings is lost daily. Our leader will come and tell us there's a lot of corruption going on. When we were having kazi kwa vijana mtaani, I swear we did not document any cases of police killings. When these young people were getting some small money every Saturday, it was peaceful. People had something to eat, and they had no reason to go and snatch out phones or do those things they do for survival. So NYS scandal happened, and the billions of money was stolen from these youths, and we started documenting extrajudicial killings again. So there's an interrelation between EJEs, insecurity, and food, which is at the center of wananchi right now. The incoming government has a lot of challenge because you must address the issue of njaa. It is the one thing that holds this country together, that citizens wameshiba, that citizens are good. But the moment we are hungry, these roads and infrastructure mean nothing to hungry and dead. The individual, there's no development without development from wananchi. We don't care for roads and expressways and railways and sijui what. We want dignity at the end of the day. Every Kenyan who wakes up to go and vote, it's to have a dignified life, is to live with social justice, basic amenities, which have been turned into election campaigns, which is so sad. So the next government, basic minimums, is a government of utu and a lack of madharau for Wakenya. Thank you so much.
Thank you very much, Mzalendo. This is Mzalendo Wanjira, okay? If you have never seen a Mzalendo, this is a Mzalendo. And thank you for the space you continue to hold in Kenya, in society, in the informal settlements of Kenya. And I hope the message has gone home. Anutu, government. Now, to close this session, as somebody who has been a teacher to most of us, who are social justice activists, has worked in informal settlements for this is a scorecard for 1 decade. He has worked for over 4 decades on human rights and social justice in informal settlements. If you're lost and you do not know the direction, look him up on Facebook. He's called Ajas Omoto. You will find his poetic writing. His name is Josiah Omoto, currently of Umande Trust. He has been behind very many reforms and policy proposals, particularly around the area of housing, has worked for the Kenya Land Alliance, Shelter Forum, Haki Jamii, and others. Ajas, karibu, tell us your reflection and that amazing t-shirt you're wearing of Karo Mtetezi. Karo Mtetezi, for those who don't remember, was a human rights activist. I'll let him finish who Karo Mtetezi is. Karibu sana, Josiah.
Eternal vigilance is the price of liberty. This day, on the 12th of July, the words of Thomas Jefferson rings in this room. Thank you very much, Lawrence and Lavender, for an accurate report. It is a true portrait of the state of human rights in Kenya. A significant development happened in this country, but which was underreported and unreported. In 2021, there were 2 landmark Supreme Court rulings. They amplify all that we have done over the last 30 years with Kituo cha Sheria, Pamoja Trust, Nubian Land Rights, the Social Justice Centers, the Defenders Coalition, Amnesty, the list is endless. I can go on, and it might take all my 7 minutes. I just want to pick 4 items in that ruling to complement this report. One ruling was on 11th January 2021. The second one by the Supreme Court of Kenya was on the 16th July 2021. The first item, the right to housing is not predicated on ownership of a title deed. Number 2, the people, however poor they are, and whatever type of house they live, however informal and however decrepit, those structures are homes to people and deserve respect and protection. Number 3, the state, through its duty-bearing organs, has an obligation to respect, protect, promote, and fulfill the rights and freedoms in the Bill of Rights. That is contained in Article 21 of the Constitution. The court basically amplified my sister Mumbi Ngugi's ruling on this matter in respect to Mitu Bell Mitumba settlement. And number 4, the state must pay for the illegal, brutal evictions. As we speak today, the Jubilee government has not. But there's something that is significant. About 3 or 4 years ago, Amnesty International asked me to go for a fact-finding mission to Mombasa, to Kwajomfu. And we found something significant the government had done. So as we work on this report, let us recognize the good, the bad, and the ugly. The government did something very ugly at Kwajomfu. At night, they went and evicted people to make way for the road. But the same government, through the Kenya National Highway Authority, went to Kwajomfu, did a census of the people affected, did a relocation action plan, sent valuers to Kwajomfu. That was not reported. And compensated people across the board, from employees who stayed in those structures, to owners of the structures, to the schools, to the owners of the hotels. Can you clap for the government for that action? It's not every day we clap for government. Clap for government. The only problem with the Jubilee government is every time there's 1 step forward, is 2 steps back. It is blue today, it is red tomorrow. And I think we need to recognize that in the report. That was blue, green. I was so impressed, I told government, I'm impressed. But since then, the government has not compensated anybody. The government operates in disdain of the law. Last but not least, moving forward, the report has made a very, very good case in terms of the enactment of the Resettlement Procedures Bill. That is a positive step. 2, as we work on budgets, the starting point, whether you call it bottom-up, because all these years we'll be teaching bottom-up, the starting point is on Article 43 of the Constitution. Let us budget with a human rights frame. Start with the food, go to the water, start with the people where they are. Not budgets that respond to the mercantile needs of the few billionaires in Kenya, the 8,300. Our budgets normally are written for the 8,300 billionaires in Kenya, not the people. Lastly, I'm very, very happy about the focus on auditing the food distribution and pricing mechanisms. That's a progressive very, very progressive recommendation. Because every election there's a food shortage. Some of the grain reserves go and food has to be imported by shadowy characters. I think that is a very, very great example. And lastly, in the era of climate change, thank you very much, Amnesty. You are talking about focusing on climate-smart agriculture and investing in climate-smart agriculture. As we move forward, and I said it at the beginning, eternal vigilance is the price of liberty. I hope Amnesty and the partners will continue being as vigilant with the new administration coming in, and particularly in the area of developing the new concept of core minimum content in respect to the right to health, right to food, right to water and sanitation, right to life, and all the bundles of rights that you have presented today. Thank you very much. As we used to say in Upper Hill, we expect, and the people of Kenya expect, that tomorrow will be better than today. Itakuwa nzuri kuliko jana. I thank you very much.
Thank you very much, Comrade Josiah Omoto, and even for the encouragement of the demands we are making and asks of the government are progressive, and we are in the right frame of things. I want to hand over now to Irungu Houghton, the Executive Director of Amnesty, to take over the next session where we will formally hand over the report card to people who are parents enough within the Constitution to take care of human rights. Thank you very much. I'm sure he will be faster than I am, so we beg your patience, and hopefully these discussions will find their way in the debates as opposed to egos. Thank you very much.
Thank you very much to Diana and Lavender, my colleagues who have been involved in this production of the assessment of the Jubilee government. And just to say that this has taken many months of fruition, so I'm just grateful to the tenacity and the imagination that it took to pull this together. On behalf of Amnesty International, I'm also thankful to the other 9 organizations that have journeyed with us: Defenders Coalition, Wango Kanja Foundation, Pamoja Trust, Umande Trust, the Nubian Rights Forum, the White Ribbon Alliance, the People Health Movement, KMPDU, represented here by the Secretary General, and HIVOS. So this is a scorecard that has been endorsed by 10 organizations as we go through. We are also very thankful to the Office of the Presidency, and in particular to the government spokesperson for heeding our invitation for them to respond to the report before we released it. And in the 75 report that you will be able to get on the website in a few minutes, you will find their comments covered there in total. So we've actually just attached their comments to the report so that you can see what government's responses were. Having said that, we are completely responsible for the contents of this report, and as we move now to hand over the report to the state agency that is responsible for promotion and protection of human rights, we just wanted to make a couple of remarks. First of all, just to say this. You know, I was going to ask us to take a minute of silence just to remember the 5,500 plus people who died during COVID. Now I actually realize, maybe as you're setting it up, I'm going to ask the chairperson to speak from there, so maybe I can shift this side. I apologize. Huh? This is the cameramen hate this, but let me get that ready. So we're going to request, let me move to the podium actually, just so that we can be consistent. So first of all, just to acknowledge the 5,500 people who died over COVID-19 period and continue to be stalked by this terrible little virus that has the capacity to bring very powerful countries to the end. We also cried and really commiserated with the families of Yasin Moyo, the 13-year-old boy who was shot on his balcony. We commiserated with the family of Ebby Samuels, the 15-year-old girl who was killed in a school as administrators practiced corporal punishment, which, if you recall over this period, the calls for corporal punishment to return to our schools have been increasing. Many of the photos that you see around here represent the many, many people who didn't make it to read this report. And we really, our hearts go out to their families and to all of their loved ones. To Sheila Lumumba's family, the lesbian woman who was killed brutally a few weeks ago. You know, as I'm sitting here, I have a phone call coming in from her mother, desperately trying to find out what had happened to her daughter. To the young man from Kakuma, Crichton Aluwara, one of the 1,000 LGBTIQ refugees that are in Kakuma, we continue to work with them. So I just wanted to say that this is not a crude indictment of the Jubilee administration by observers. We are not observers. In fact, under the Constitution, human rights organizations are obligated to monitor and to hold states accountable. We also share that obligation with state offices. And for state offices, they have a higher threshold of responsibility to protect and promote the rights of Kenyans. Chapter 6 and Chapter 4, the two chapters that relate to leadership integrity and to the Bill of Rights, and indeed the whole Constitution, are not optional for any government. So as parties are writing their manifestos, as we see them writing and sharing their manifestos, as we listen to them in the various debates at gubernatorial level or at the presidential level, we have to remind them that those manifestos have to be rooted in the Constitution. The Constitution is not optional. The Constitution is an obligation for everybody, individually and collectively, who comes before us to protect us. 46%, which is what we have graded the Jubilee administration, we think is a balanced assessment. Obviously, there will be some disquiet in government offices, but let me just start by saying that honesty is probably the first starting point for improving anybody's performance. Now, the Jubilee administration is outgoing. We have just a few weeks to go. But there are a number of other administrations that will take control and will occupy the responsibility of the 47 county administrations and the national administrations. And collectively, they will manage a budget of 3.3 trillion Kenya shillings. And the question we need to ask them is whether that budget will be applied to paying back Chinese and European loans, or whether it will be paid towards fulfilling the rights of Kenyans. So as we lean into this period of fiscal austerity with the concerns that corruption has not been dealt with, our thoughts have to be with 47 million Kenyans at this point. And with that, let me very warmly welcome the chairperson of the Kenyan National Commission on Human Rights, Rosalind Odede, a friend and a sojourner on this step towards a country that respects and protects human rights for all. She represents an institution, and some people get this confused. The Kenya National Commission for Human Rights is not a non-governmental organization. It is not a civic agency. It is actually the state agency that is responsible primarily for ensuring that all government agencies respect and lead on human rights. And therefore, as an Article 59 organization, it gives me great pleasure to welcome Rosalind to speak this morning and to receive this report, because as the Jubilee administration exits in the next few days, it is the National Commission that will hand over the responsibility, or could hand over the responsibility, to the incoming government. Karibu sana, Chairperson.
Thank you very much, Irungu. Good afternoon, ladies and gentlemen. Thank you very much. I'd like to start by thanking Amnesty for inviting me here today to listen to this report, which was well articulated by Professor Mute. Thank you, Professor. for that very, very fantastic report and well presented. And Lavender as well for your bit on the asks. Thank you very, very much. This report is actually something I was looking forward to. As a commission, this keeps us on track on what we are doing, and it actually enables us to understand whether we have our feet on the ground or whether we have our feet above the ground. And when I got a notice of this report and snippets of it at that point in time, I looked at it and I smiled. I didn't smile because it was a good report, but I smiled because it reflected the reality of the situation. And I want to thank your team for being very, very objective and balanced in their reporting. Where things were good, they mentioned it, and where things are not working, they mentioned it. We are all Kenyans. We all live here, and we understand and appreciate the veracity of this report. But quite apart from just appreciating the veracity of the report, we must ask ourselves as Kenyans, is this how we want to continue to live? Is this the best we can do for ourselves? And I think we as a commission have a duty, but we as Kenyans all have a duty to call the government to account where the government is failing to do its best. So I'm glad that this report is out, and I'm glad that it actually states the things that we have been paying attention to as a commission. And a lot of the things you're asking for, I think, are things we can partner on and work together on as we go forward. There are lots of things that you have in the asks that I think we already look into. Things like the death penalty are things we have been looking at. If I could just look at what is in the report. Yeah, I think there's a lot here, like operationalizing the Prevention of Torture Act, the Coroner Service Act, and the Victim Protections Act. Those are things we've been pushing, and we'd be glad to have partners helping us ask that moves forward. Ratifying the optional protocol is an issue we keep taking up every year with the Attorney General. And I think if we have more voices clamoring for this, we might just be moving in the right direction. The Public Benefits Act is also another one, and the National Security Laws amendments are also other issues we have been looking at and trying to agitate for. So I think there's a lot here that we can work on. The rights of the LGBTQ groups, especially around their sexual orientation. We have Resolution 275 from the African People and Human Rights Commission. And the government really needs to protect all lives as lives. We all have a right to life, despite what I may be, what I believe in. I could be atheist, I could be wherever I am, but we all have the right to life. We all have the same protection under the Bill of Rights. And it is wrong for anyone to condemn people and kill Sheila. I think these are very low moments for us as Kenyans, and things we must always be ready to speak about. And we are ready to call for implementation of Resolution 275 as a commission. In fact, today after tomorrow, I'll be speaking to them about this Resolution 275 so that we protect all lives. We respect all life. We dignify all lives and respect people's choices. If we have choices in the political space, why can't I have choices about my sexual orientation? It's a personal choice. I'm not forcing it on you. So let's just protect and promote all lives in this space if we can. And I think these are very, very good issues that you bring up. Some of the asks around the civic space affect me too. As a commission, our financing, often very limited. But we come up with innovative ways to go across that bridge. Of course, our access to development partners is also limited to certain extents. You saw letters coming from Treasury saying we cannot receive funds from X, Y, or Z. But we come up with innovative ways to always get this development partners to support us in this journey towards us attaining human rights. Human rights is always treated, the commission is, sometimes government thinks we are an aggressor. They think we are here to speak out against its ills, and no one likes their ills being mentioned. Sine qua non. Like if I walked up to you and told you, hey, your hair in a kambaya,
you know, he wouldn't like it. So even I think that's how government looks at it. We are probably a small, an irritant in delivering on our mandate, but that's what we have to do. We have to make people uncomfortable. And got home late, I was arrested and detained. Because I could not wear a mask, I was arrested and beaten up. Because I could not bribe a police officer, I spent the night in a cell. These are realities of our lives, and these are things that come to our attention. And we put them in our reports, and we try and give advisories to government. But having you on board, helping us push some of these narratives, is a very, very useful thing for us. It actually validates some of the things we say and are disregarded at the table when it gets there. At the Commonwealth Forum for National Human Rights Institutions, we actually loudly debated how COVID violated human rights, how the pandemic, the handling of the pandemic violated human rights. We even spoke about things like vaccine apartheid that we saw. When the vaccines came out, Africa was sidelined from the first batch of treatment. We have talked about things like mandatory testing, mandatory vaccination. You can't travel to most countries now if you don't have a vaccination certificate. Is this fair? And these are things we take up also on the global plane, because it is like certain countries are being forced into testing and vaccination to be able to get across. And then the right of movement is guaranteed under the Universal Declaration. So some of these things are things we are also taking up at national forums so that our rights as a people are safeguarded. And I think these are things that we will continue to talk about. What really touches us and which we speak, we have a whole program of at the Commission, is the enforced disappearance and extrajudicial killings. It really pains my heart that we have a government that does not pay attention to the right to life. The Constitution enshrines life and gives it life even before birth. It protects a fetus, but it can't protect me when I'm walking on the streets. These are really hard moments for us as Kenyans. But as a commission, we've taken up the issue very, very seriously. We discussed it with the, when we were appearing at the African Commission. And it was agreed we'll have a project around it. We'll probably invite some of you to join us into that project so that we can dig deeper into the issue and come up with lasting solutions around it, because one more death is one death too many. The sooner we stop it, the better for all of us. So this is something we will work together on and hopefully dignify the lives of Kenyans as people and as Kenyans. And even if you're not a Kenyan, as long as you're within the territory of Kenya, your rights are protected. We value each and every life that is within this country. Housing and forced evictions. We celebrate the judgment from the African Court for the Ogiek community. We really do celebrate it. And we issued a statement last week requiring government to comply, and comply immediately. And we intend to monitor compliance of that decision, because it will have trickle-down effect for all other people, especially around the cases that came from the Supreme Court that actually validated the right to housing, the right to ownership of the space where you occupy, the right to title, the right to some of these rights that were actually validated by the Supreme Court. And we have been in discussion with the Attorney General on how compensation can happen. And we are ready to moderate, we've offered to moderate the issue so that we can have a team putting together and audited who needs to be paid, who is yet to be paid, who has been affected, so that we can have compensation occurring. But is compensation sufficient? And that's why we want to have broader discussions. Because it's not just compensation, these people have suffered. These people have been rendered homeless in their own country. It's not an enviable position to be in. And we must shift out of our comfort zones and address some of these thorny issues, because they keep coming up, they keep rearing their ugly head every time. And it's used sometimes by politicians to bring us into conflict with one another when it works to their benefit. So we must watch this space, because it leads to greater violation of rights going forward. So I think those are things. And indeed, development should not be at the expense of human rights. So these are things that we keep looking at. When it comes to security as well, the other day we visited Marsabit, Baringo, and Marakwet, because there are curfews there. And our point of view when we went in was that the police has a duty to provide security for all without limiting our rights. I cannot have my right to movement, my right to trade, my right to engage limited because the police have failed to enforce security. But when we went into Marsabit, Baringo, and Marakwet, we found that the people actually appreciated the curfews. They were actually saying because of the curfew, there's a modicum of peace in the area, and they are able to spend the night sleeping and not worrying about being attacked. And that's okay as an interim measure, but we have asked government to ensure the citizens of those regions that their security will be assured, that they shall be provided with long-term solutions and not have the sporadic curfews that keep being called, and the bias that we see in allocation of resources to those areas vis-a-vis other areas in terms of security. So those are issues we have taken up and we continue to take up. Food security. Tumbo manenos are very serious manenos, isn't it? When I was in school, I was told that a hungry man is an angry man. And we've got to realize, I don't know whether somebody here just said, if there's hunger, there's chaos. Where there's hunger, we keep having a lot of conflict. And therefore, we must realize that food security is a non-negotiable. And it is something that we need to work around. We have programs on climate change and how it affects human rights. We have right now climate change, what do you call them? Immigrants. People who have had to actually relocate because of climate change. So climate change is real. It's affecting people's livelihoods. It's moving people from their homes. It's making people destitute. And we've got to link it back to how it affects us. The food security in Kenya, therefore, is a problem. But I think the greater problem for us is the corruption and our budgeting and how we fail to budget in a human rights and sensitive manner. And we've got to find ways of ensuring that it is not food that is always the first victim of any economic crunch. We've got to actually do what you say about auditing budgets, auditing how budgets are allocated towards agriculture, food security issues, and even just reducing taxes for farmers. The other day I was alarmed. Actually, I took it up with my CEO to give me further details that KRA wants to start targeting small-scale farmers. And I was alarmed. I was like, we can't even afford food now, so you want to tax the farmer so the farmer charges us more for the food? Honestly, that's very inconsiderate, and I think we are watching that space. I just saw it as a news item. I'm yet to get to the bottom of that, but we need to be very alert to issues of ensuring that we can feed ourselves. You know, Kenya is a very agriculturally well-endowed country. It's actually laughable that we can sit here and cry about food, scarcity of food as a country. It just means some of our policies are not working. It just means our priorities are probably not working. and a lot of attention paid to that will be very, very useful. So Amnesty, I want to thank you for this report that actually resonates with us at the Commission in terms of what we have. If you look at our reports over the last 1 year, we capture almost all these items. Where you give a red flag, it's actually a valid red flag, and attention needs to be paid. And I haven't read the 75-page report. I want to spend time reading it. We will interact and intersect with it, and I will be coming back to you as a commission so that we can see areas where we can work together. But I thank you for this report. I thank you for putting it together, and I think this is a very opportune time to produce this scorecard because it speaks to us about the past, and it tells us the pitfalls to avoid going forward, and we will hold government to account. As a commission, we undertake to do that with your support. Thank you very much, ladies and gentlemen.
Thank you very much, and best wishes to the other commissioners and to the staff of the Kenya National Commission on Human Rights, particularly as we lean into the post-election period. It will be a busy period, I suspect, for us. So we wish you God's grace and strength and the courage to do this. Okay, we are very close to we're over time, and I know there are a number of things that we need to. I just want to check whether there is a representative of the Attorney General here, from the Office of the Attorney General. They had confirmed this morning, but just to see whether they've been able to make it. I know our Attorney General himself was not able to come because he's recruiting judges, which I think is a good thing. So we are hoping that that process goes well. Let me just also acknowledge the presence of representatives of political parties and political party alliances. If you can please stand. I can see one who has a long history of human rights protection. Are there any representatives of political parties here? At the back? Oh, way at the back, yeah. Welcome and thank you very much. This report is as much for the Jubilee administration as it is for those of you who seek to govern us, and we hope that you will read the contents and implement them as best you can in the season that comes. If I can just invite a few people to come to the front. If I can invite Diana and let me invite also Lavender and Lawrence to come to the front. And also if I can invite I guess the Secretary General, any of the representatives of the organizations, the 10 organizations who were involved in the development of this report, if you can come to the front, and the chairperson of Amnesty International Kenya also. We're going to hand the report ceremoniously to the Kenya National Commission for Human Rights. And I will ask my chair to hand over to the chair of the Kenya National Commission for Human Rights. So if you can grab maybe 5 copies. I think we need one for State House, for the incoming administration, one for the Ministry of Interior, and potentially there may be a Constitutional Affairs Ministry, who knows, one for Health, one for Agriculture, and so on. For the cameras, please position yourself. We're about to do a photo moment. Let me just check with the cameras. Okay. Yeah, feel free to move the furniture around. And we've switched off the lights. Do we have all of the other representatives? No members, no representative from Umande Trust. I thought Josiah was here. Let me invite Josiah to come up. So the organizations, again, just to make sure that I call you out specifically. Pamoja Trust, Defenders Coalition, Wago Kanja Foundation, White Ribbon Alliance, People Health Movement, HIVOS, Nubian Rights Forum, please come forward. And then if I can have a war next to Rosalind. So welcome, yeah, come right. Actually, yeah, if you switch places, that would be best. Okay. Thank you very much. If you can hold the paper, the reports up at the same level, that will look neat for the viewers. Thank you very much. Excellent. Thank you very much to all of you present. We will take a few questions. Obviously, the press will have questions. I'm going to invite the people who are up front here to stay behind in case there are questions from the press. For everybody else who is not part of that process, please thank you for coming this morning. Please do help yourself to any tea or coffee that may still be remaining outside. And please visit our platforms and the website to get a full copy of the 75-page report. Thank you very much for coming. And for the journalists who would like to interview, please come to the front so that you can interview your questions. For those state officers who are still part of the Jubilee administration, there is for those of you who are Christians, there is a particular scripture, Timothy 4.7, I have kept the faith, I have finished the race. We sing it a lot when in funerals. Perhaps I could make a request. There are still a few weeks left. Surely the officers of Pangani Police Station, having been named in the Missing Voices report as being responsible for 50% of the 180 deaths last year, surely we need to see some action before the end of this administration. For the police officers who have been named serially, and I won't go through the entire names now, but I think Officer Blackie, Officer Rashid, and various others, surely we are not going to see this administration leave without action taken on them. To the 40,000 people of Mukuru kwa Jenga, the 3,000 people of Kibos, the 30-plus bodies that floated down Yala River at the beginning of this year, and I can see my comrade and fellow director, Hussein Khalid, who is also here. Surely we are not going to allow the administration to close without taking action on these cases. Could we even see one arrest for any of these cases? Surely we cannot close this administration without seeing action on the killers of Sheila Lumumba, the killers of Joanna Stutchbury, the killers of all those bodies that went through Yala, that were found in the Yala River. Surely we cannot let this administration close without seeing closure on these issues. Thank you very much for coming. Please continue to monitor. Please tweet, post. Hashtag is Jubilee Scorecard 22. Thank you very much for coming.